what we're going to be doing now is evaluating the client's internal and external rotation. We're going to be looking for the end feel, whether it's bone on bone or whether it's leathery. We're going for a leathery end feel. So let's test the range of motion. Internal rotation should be 45 degrees and a leathery feel. If you find that it's maybe 35 degrees and more of a bone-on-bone feel, then we need to do the joint capsule work. We're going to be gently grasping the leg and going into the direction of the way that the client cannot go. So what we're trying to do is, that's acetabulum fossa here, we're trying to take that bone, the head of the femur, and push it in to the joint capsule to loosen those deep fibers. Then step 1. Step 2 is capsular stretch. 3 would be traction. So let's try that again. We're going to internal rotation. If the person has some knee issues, you want to kind of brace the knee. So if they're 40 or 35 degrees, bone on bone, we're going to be doing the rotations in. Not too hard, because if you're pushing in too hard, you're going to jar it up. So we're just going to try to engage. In. Step 1. Capsular stretch, deep capsular stretch. 2, 3, traction. Measure 45 degrees and leathery. What we're going to be doing next is testing their external rotation. It should be 60 degrees and leathery. If it's not quite 60 degrees and leathery, if it's a bone-on-bone or an abrupt end feel, we're going to be doing that rotation for the joint capsule. In, rotation, step 1, rotation. Step 2, capsular stretch, deep capsular stretch. 3, traction. So what we're measuring here again is the internal rotation, 45 degrees and leathery end feel we're looking for, and 60 degrees of external rotation. Occasionally, the client's anterior fibers of the head of the femur become very anterior and stuck. So these fibers here on the anterior in the joint capsule are stuck. We're going to measure for that right now. So what we're going to do is straight leg, and we're going to brace the PSIS and iliac crest and kind of derotate as to not jar the leg up, and the hip being torqued this way. If someone has some back issues, you can place a pillow underneath the belly. So we're going to brace here, and we're going to try to measure the range of motion. The range of motion of the extension of the hip here should be 35 to 45 degrees and leathery. And she does have that, maybe a little bit more. So psoas and iliacus are allowing that release along with the rectus femoris. If someone was to have less than that, maybe 20 degrees and bone on bone, what we're going to be doing is we're going to be taking the acetabulum fossa, and we're going to be taking the anterior fibers of the head of the femur, and we're going to be loosening the joint on the inside. So right under the gluteal fold, above the knee, and like this. So my hand on the knee is going up. It's kind of a tilt motion like that. And now we're warming those anterior fibers of the joint capsule on the anterior, because of all our sitting and flexing. Those fibers of the head of the femur move anterior and get kind of stuck. So what we're trying to do is push them in on the anterior to get that full range with the iliacus and psoas. So we're going to be measuring. All right, so it's 30 degrees or 25. We're going to come in, and it'll be bone on bone. We come in here this way, just like this. And then we test again, 45 and leathery. So we're testing the end feel. Remember, if it's a bone-on-bone end feel, you're going to be doing joint capsule work. If it's a leathery feel, you're going to be working the muscles themselves. 45 leathery, 60 leathery, and here is going to be 35 to 45 leathery.